Thanks for joining us on Tandem Radio for a very special segment, By Design, focused on helping you understand how God designed you so that you may be healthy and productive in fulfilling God's purposes in your life for many years to come. Now let's join our host, health expert and public speaker, Dr. James Proodian.
Welcome to the By Design radio program. My name is Dr. James Proodian of Proodian Healthcare and ProodianHealthcare.com, where health literacy is the key to longevity. And as long as God has us on this side of eternity, my show is designed to help educate you and your families to feel better, function better, and live as many quality disease-free years as possible. Thanks for joining me this week. We're just coming off of 2 weeks of immune function, and we're starting show number 36 today. We're leaving foundational subject matters. I'm going to be speaking to you over the next couple of weeks on topics. As hopefully you've been keeping up with my show, you know we go in and out between foundation and topics. And topics are things that hit my desk that I'd like to share with you. And I think I could get through the next 2 to 3 weeks. We're going to be doing some topics. Before I get going today, let's do our Bible verse, Luke 1:37. For with God, nothing is impossible. And that Bible verse is the standard Bible verse for By Design, because what it means to me and for all of us is that with education, the body that we've been designed with is so resilient for change and can make change that proper education and literacy into the proper design that we would design with can really help not only us to feel better, not only to function better, but to live longer. And the next couple of weeks, that's exactly what we're going to be talking about. You may have noticed throughout my shows, I am not the guy who's going to give you the top 10 things to eat or the top 10 things to do to reduce stress. That's not my deal. You know, one of my degrees, when I was a pre-med student, I got a degree in public health. And public health is chock full of statistics and looking at patterns. And patterns of epidemiology are so important that as a society, we look at what actually are the things that are occurring in our society so that hopefully we're smart enough to make changes. So for instance, 100 years ago, the leading cause of death in women was childbirth. You know, I think number 2 was maybe tuberculosis. And so when you look at accidents, tuberculosis, childbirth, these are things that we have done such a good job in our society of learning, making changes through proper medical care, hygiene, etc. But now what we're left with when I get into the topic of today is a system that's so focused on creating chronic illness. And my point to today's show is that's not the design, certainly not God's design. So what we're going to be doing today is we're going to be kind of take a step back in time. And I was born in 66, so I grew up in the 70s. And I remember coming home from school. My favorite show on TV was Superman. And I don't mean the Christopher Reeve Superman. I mean the black and white Superman. Maybe some of you guys out there, maybe you gals too, remember that. But it was the best show on TV as a little boy. And I always remember Truth, Justice, and the American Way. Every Halloween, I was Superman. And I just remember that phrase, Truth, Justice, and the American Way. And you know, the word truth to me, and I know there are people out there listening to me who are pastors and far brighter than I with that word and the biblical meaning of truth. But lately in the media, for instance, I've just noticed that truth has really come under the microscope with all of the various scandals going on in our country. And I'm not a heavily political guy, but I watch it and I see what is the truth. You know, all of us are probably sitting there like I know I am, and I watch some of it and I say, just tell me exactly what happened. What is the truth? So the By Design program is all about having a conversation, even though the conversation I'm having is with a microphone and I don't get to see your faces like I do when I do my public speaking. But this is all about a conversation based upon truth, based upon science and evidence. And the problem or the issue with a lot of what I'm talking about is it's no longer under debate. These are what I'm talking to you about week in and week out are pretty much, and you'll see that today, issues that have been solved. Yet our country and the leaders of our country don't want to accept the truth. From a government perspective, from a food manufacturing perspective, from a stress perspective, we're not living by design, and we're living far from it. So the topics over the next couple of weeks, we're going to talk about sick care versus health care today. Next week, I'm going to be talking about our immigrants coming to our country and what happens to them by adopting an American style of eating. I'm also going to be going over, like I shared with you last week, I told you I was going to be doing meat and the consumption of meat, but also what the biochemical properties of meat are today versus like 200 years ago. So part of what I wanted to do today also was just to kind of clear the air that we all know that tragedy and trauma exists. This show is not created to talk to you guys about the tragedy and trauma of life. Every 2 seconds, someone dies. And you know what? The last time I checked, 10 out of 10 of us are going to die. So, the reality that 10 out of 10 of us die, the show is not created to in any way talk through the tragedy and trauma or the fact that, inevitably we're going to die. Fine. But our sort of journey on this earth, we could certainly be doing things that empower our immune system, to fight off infection, to not live in a toxic environment, to decrease the amount of inflammation in our food supply, to improve our digestive system, to create more energy, and to do the things like reduce stress on a day-to-day to make our lives more enjoyable. And in my opinion, that's one of the things that I try to do every day to honor God and His glorious design. So let's take a look at an article. I'm going to share with you an article today written by Dr. Mark Hyman, Hyman. He's a medical doctor, practices functional medicine. I've seen Dr. Hyman speak a few times. He's written some very good books. So if you want to go to Amazon and look him up, you may want to pick up his books. He's a doctor who basically is writing and lecturing, as I try to do, in this world of functional medicine by connecting the dots. And years ago, he wrote an article, and as I was going through preparation for shows and seminars that I do through my Wellness at Work program, I really like this. So I'm going to share with you some of it. So I'm just going to read for you. Let's sit back and try to take in what man has done over the last 200 years to our healthcare system. Let's start. Most of us believe that our country's healthcare system is designed to keep us healthy. In fact, it does just the opposite. Think about it. What fuels the healthcare economy? Sickness is the answer, not health. So sickness is what's fueling the economy. All the stakeholders in industries that affect our health, the pharmaceutical industry, the food producers, agricultural business, restaurant industries, profit when people eat unhealthy food, exercise less, and are more stressed. They're making money off of poor health. So let's be truthful. Remember, truth, justice, the American way. We're going to focus on truth. The reality is more money is made by having more people sick. Just take a look at the commercial that encourages you to eat unhealthy food because an antacid pill or two can ease the indigestion that gives you. Thank you, Mr. Actor or comedian who represents that antacid. Typically, it's somebody overweight, living a poor lifestyle, and they're eating chili dogs and corn dogs, and then just take the antacid to relieve the damage you just did to your body. Let's continue. Worse, our healthcare system is based on the outdated idea that disease should only be treated, not prevented. It's really disease care, not health care, or as I call it, sick care versus health care. Simply put, sickness is good for the economy. And it's not just a problem here in the United States. Let's look at what's happening to the health of the rest of the world's population. It's not very pretty. Most people in developing countries die from infectious disease like cholera, diseases preventable by immunizations, or respiratory infections. Obesity, heart disease, cancer, and chronic diseases are confined to the civilized world, right? Wouldn't you agree with that? Well, not anymore, folks. It used to be. Chronic disease, now follow, chronic disease has replaced infectious and acute illnesses all over the world. Now are the leading causes of death in the world, both in developing and in developed countries. So now we've replaced the things that in developing countries like cholera and diseases prevented by immunization, and also respiratory diseases, we've replaced them with man-made chronic illness. Now, and the tragic part is that these ailments can be prevented. They're almost entirely attributable to lifestyle risk, the factors such as poor diet, sedentary lifestyle, tobacco, and alcohol use. But the fact is, 1 billion people in the world are now overweight. 300 million are obese. 1 in 3 children born today will have diabetes in their lifetime. 1 in 5 children in China will be overweight by the year, it's already happened, 2010. Now, when we look, let's continue. The answer is clear, but no one is listening. And I guess that line, I'm going to stop there for a second. Dr. Hyman said it best here. No one is listening. For 20 years, I have spoken throughout this state, other states, pretty much always for free. Wherever they have me, I do lunch and learns. I do about 60 to 70 events a year in corporate America. I keynote at the Garden State Human Resource Association last year. I'm all over the place. And one of the things about doing seminars is that we know what the answer is, but are people really listening? And let's continue with the article. Well, but not everyone is listening. Well, the answer, why? It's stunning information for some people. For the first time, we're learning how the body works as a system and how nutrition, nutrients, and lifestyle affect our health. These changes are so monumental and so contradictory to what we all trained to think in medical school that for most doctors, it's too difficult to grasp. So if we go back and we look at the interconnection, for instance, of the epigenetics that we talked about and how that's tied into detoxification and digestion and our immune health and stress and fatigue and how all of these things are tied together, what Dr. Hyman is saying is that the information that we're learning about how the body works as one system, not individual systems, is sometimes hard for doctors to grasp because it goes against what they're learning in medical school. So it's like Columbus saying that the world is round, or declaring that the earth is not the center of the universe. Copernicus said. It makes sense, but it's so shocking that some people just don't want to believe the truth. The only way this will change is for the average person. That means you. That's why at Natural Healthcare Center, for instance, this is the year of the family. It's time to take back our health one person at a time. Proodianhealthcare.com. Go there, learn about what I do. Subscribe to drproodian.com, which is my blog site, or even go to Dr. Hyman. Continue the education, because for the average person, it means for you to vote for change every day with your fork and your feet, as Dr. Hyman says. And when it comes to your well-being, there are changes you and your family can make to get healthier. And stop feeding our culture sickness. Stop feeding our children the sickness. And here are some suggestions for you guys. Eat real whole food. Does that sound like God's design? Eat organic and locally grown foods as much as possible. Up to 200 years ago, was there anything other than organic food? Of course not. It's God's design. Give up all processed and packaged food. That's what some guy Bob made in a laboratory. Give up sodas and sugary drinks. If you do, I can guarantee you that Pepsi and Coke will be healthier. They'll make healthier things for us to drink. So let's give those things up. Eat slow food meals that are made from scratch, not processed. With enough demand, we'll start to see more slow food restaurants, not fast food, slow food restaurants. We want food made from scratch with healthy oils and healthy ingredients. Don't buy foods you see on commercials. Don't let your children watch TV commercials. Junk food companies spend $13 billion a year in advertising junk foods to our kids, who see 10,000 junk food commercials every year. Don't buy foods with trans fats or high fructose corn syrup with more than 5 ingredients, or ingredients that you don't recognize. And walk where you can instead of driving. See, we have to demand from our doctors that they learn systems medicine, not just disease care. If you want, go to www.functionalmedicine.org, and you can learn more about functional medicine or Dr. Hyman's work that I do in clinical practice, and what I'd like to call connecting the dots in people's health, looking at them as a whole individual. I look at it as the way we were designed to be treated, diagnosed, and at the same time, what our doctors should be doing for us from a nutritional, psychological, and physical perspective. Ask your doctor to help you correct the cause of your problem rather than prescribe another medication. If you write to Congress demanding independent scientific hearings on nutrition and health, and demand they put those findings into public policy. Talk to your friends and colleagues and devise ways to make it more profitable for our society to be healthier than to be sick. The choice is ours, guys. Why do you think our healthcare system is this way? Have you gone to the doctor only to have your symptoms treated while your underlying cause is ignored? Do you have other suggestions on how we could stop feeding our culture of sickness and do the smart thing and shift the focus to prevention? And I want to really thank Dr. Mark Hyman, who's been a real pioneer and leader in functional medicine and has written some great work with respect to this subject matter. You know, we always want to deflect blame. And it seems as though sometimes the truth is too much to handle. It's just amazing how the truth could be right in front of us. It's right there. It's crystal clear, the things that we should do, and human behavior, which is many times dictated by TV commercials, by the norm of the culture, which I hear all the time, and what we should be doing. And By Design is all about being truthful. I want to end today's program by understanding that tragedy and trauma is out there, guys. And again, this show was created for you guys to look at what we do every day of our lives in a real meaningful way. My prayers and my thoughts go out to everyone in Oklahoma this week, as I'm sure yours do. It was such a tragedy to see Oklahoma. I lived through Hurricane Sandy down here along the Jersey Shore, and all of us remember 9/11. These types of things are not preventable many times, and it's part of life. And just hearts, prayers, and thoughts for everybody in Oklahoma this week. Thank you for sharing a little bit of time with me this week. And if you can, please go to ProodianHealthcare.com, submit any questions you have for the show, and please become a blog member. Let's keep the conversation going. Be well, and God bless you this week.
You've been listening to By Design with Dr. James Proodian of Proodian Healthcare. To learn more, visit us at tandemradio.com, that's tandemradio.com, or on Facebook. And don't forget to email us with your questions. We'd love to hear from you. In the meantime, hope you have a healthy week, and we look forward to you joining us next time for more fantastic insights from Dr. James Proodian on By Design, a special production of Tandem Radio.